Of adults have avoided sports due to the fear of dental injuries? Well, it's kind of time to face those fears and get you back on the fields or the courts or whatever your sporty aspirations might take you. So joining us today is Dr. Craig Hirschberg, the president of the American Association of Endodontists, who's here to shed some light on how to protect that million-dollar smile while still enjoying your favorite sports. Welcome to the show, Dr. Hirschberg.
Thank you.
All right, what are your latest survey reveal about people's fears of sports-related mouth injuries?
We were a little surprised that about a third of the people surveyed were avoiding playing sports out of fear of having a tooth knocked out.
And what are your tips for someone if they did get a tooth knocked out?
Well, if you've had a tooth knocked out, hopefully you know where to find it. If you've recovered the tooth, what you want to try to do is get that tooth back in the socket as soon as possible. So the person who sustained the injury or somebody assisting them can take that tooth and shake it free of debris, don't scrub it, and get that tooth placed right back in the socket where it came from. So understanding that sometimes that isn't possible, or it's beyond somebody's comfort level, then it's important to get to an endodontist, to a dentist, to an emergency room, seek some care and get it replaced as soon as possible. Now, if you can't get it back in the jaw as soon as possible, that tooth needs to be kept moist. The ideal thing would be to take that tooth and place it into a container of milk, and the colder the milk is, the better. And that would be a good material to transport the tooth in when you go to seek emergency care. So, and time is of the essence. You really want to get that tooth back in, less than an hour, under a half hour would even be better.
Can you explain the difference between an endodontist and a general dentist?
Well, an endodontist is a dentist who's had a minimum of 2 years of additional training, and that would be additional training in complex endodontic procedures, so a lot of that is root canal therapy. They've also had a lot of training in advanced pain control, and they also have a great deal of additional technology that you may not find in a general dentist's office. And it's a great resource in the event that you have a dental injury or if you're experiencing toothache pain.
Dr. Hirschberg, thanks for joining me. Where can we go for more information and learn more about us?
Well, good source of general information on the topic would be AAE.org. And there's an entire area on our website for patient information. Or in the event that an individual has sustained a dental trauma or has a toothache, findmyendodontist.com is a great resource. There's a database there that can enable people to refer themselves to an endodontist for advanced care.
Thank you again joining for you this morning, Dr. Hirschberg.
Thanks, Dan.
October isn't just about